Thank you for joining. My name is Binu. I'm Associate Professor at the University of Miami and Chief of GI and Hepatology at the Miami VA. We are here to discuss the AGA clinical practice update on the management of ascites, volume overload, and hyponatremia and cirrhosis, published in Gastroenterology. I'm delighted to welcome my co-author, Dr. Eric Orman.
Thank you, Binu. My name is Eric Orman, and I'm Associate Professor at Indiana University.
So, Eric, what do you think of some of the novel aspects of the CPU?
Thanks, Binu. One novel aspect is that we finally give practical guidance on inpatient management of volume overload. Clinicians often struggle with how to escalate diuretics in the hospital, and we tried to offer clear, bedside-focused recommendations. That includes not only furosemide, but also alternatives like bumetanide or torsemide, which are rarely discussed but very useful in certain situations. For refractory cases, we outline a straightforward escalation approach, starting with IV loop diuretics and adjusting frequently. Early involvement with nephrology and consideration of ultrafiltration can also be important, especially in liver transplant candidates. So, Binu, what do you think are some of the novel aspects in the management of hepatic hydrothorax?
Thanks, Eric. So there's not been a consensus on when we refer to hepatic hydrothorax as refractory. And so here we define refractory hydrothorax as something that's unresponsive to salt restriction and diuretic therapy and requiring at least one therapeutic thoracentesis. And although thoracentesis is generally safe, complications such as bleeding and re-expansion pulmonary edema can be serious. And therefore, we recommend that patients with refractory hydrothorax be evaluated for TIPS and ultimately for liver transplantation. In patients who are not candidate for TIPS, we do advise consideration of an indwelling tunnel pleural catheter, either as a palliative option or as a bridge to transplantation in patients with expected short wait times.
Thank you, Binu, and thank you all for joining us. For more details, please refer to the full CPU available online.
Thank you.